I want to now welcome from University College Cork Dr. Michael Byrne, who's the head of Student Health Department. Dr. Byrne, you're very welcome.
Agus gaidal sios botlam mo bhílas gháil latsa as up to Cttee atá déantar an ábhar tábhachtach seo. I'm Dr. Michael Byrne. I'm head of the Student Health Department in University College Cork. I'm also co-coordinator of UCC Health Matters, which is an initiative that is seeking to make University College Cork a HSE recognised health promoting university. And I was the founding medical director of UCC's first responder automatic external defibrillator programme that has overseen the provision of 40 automatic external defibrillators in multiple locations on and off the campus in UCC. I'm a trained healthcare AED provider and have previously been an AED BLS instructor for both healthcare and lay personnel, and I'm co-lead along with Professor Hourihan of UCC's Anaphylaxis initiative. And I'm more than happy to defer to Professor Hourihan in terms of the research, science and the application of knowledge in the area of anaphylaxis, especially in the paediatric setting. He's acknowledged as a world expert in the field of anaphylaxis, and I think Ireland and indeed Cork and the Munster region are particularly fortunate to have the services of an expert such as he. My own passion, interest and concern in this area arises from my role as the medical practitioner on site, responsible for protecting the health, welfare, well-being and safety of over 16,000 to 18,000 students on campus daily. As head of the Student Health Department, I lead a team of healthcare professionals endeavouring to anticipate and provide the full range of the usual presenting problems that occur in the primary care setting for a population comparable to any large rural town. But in addition, as a student health physician, I'm challenged with anticipating and providing for the unique health threats and risk-taking behaviours that are prominent in a third level setting and among students. And to date, we have had a number of notable successes, including in the area of alcohol-related harm, with the successful implementation of a University Alcohol Action Plan, which has been recognised both nationally and internationally as an example of best practice. A particular success in the area of life-threatening emergencies has been the establishment of the First Responder AED programme on campus, with the recruitment and training of lay university personnel to act as first responders, along with the deployment of 40 AEDs throughout the campus. And can I say that within 1 month of the introduction of AEDs on campus for the first time in University College Cork, we had the great fortune of managing to save the life of the parent of an attendee at a conferring ceremony who was successfully defibrillated. All of which I cite by way of illustrating that we believe in UCC that we have an established track record of identifying real life-threatening risks and implementing innovative and effective solutions to mitigate these risks. And it was in that context that I was particularly delighted to be approached by Professor Hourihan in 2010 and 11 to seek to establish a comparable first responder anaphylaxis auto-injector program, which we managed to design and implement, ready to go live in 2011. So it is with some dismay, therefore, that we continue to be unable to activate this innovative and life-saving pilot project for the want of appropriate legislative approval. We contend that given the in-house expertise, the established proven track record and the unique high-risk practices that this anaphylaxis-prone age group display, that there's no better setting in which to demonstrate proof of concept and to establish such a first responder anaphylaxis auto-injector pilot program. Life-threatening anaphylaxis is thankfully rare. We very rarely see cases of near-death anaphylaxis in a student health department premises. Very rarely indeed. But we have done so. And in my 8 years as head of service in UCC, we have saved at least one life directly in our own emergency treatment room with life-threatening anaphylaxis through the prompt administration of adrenaline. That's one life in 8 years. One episode of anaphylaxis on our premises in 8 years. But that's the problem because, in fact, there will be many more episodes out with our premises. Anaphylaxis will occur when someone is not in our premises, when they are in the library, when they're on the running track, we're on one of the multiple eating places on campus. It will occur at night and it will occur at weekends. It will occur when we are closed and not available. Students are risk takers. It is in their DNA. They see themselves as invincible, and even those who know themselves to be at risk will often ignore that risk. We anticipate that those who know they have anaphylaxis may not even carry their auto-injector on many occasions. Few, if any, will step forward and admit to having an issue with food allergy or anaphylaxis, not wanting to stand out in any way. Indeed, in 4 years, despite regularly prompting and encouraging self-declaration at registration and orientation, I haven't had a single student who's come forward to tell me of an existing food allergy so that I could establish and compile a risk register. This is a high-risk, vulnerable population. We believe we have the expertise in-house and the willingness to embrace this challenge. We have an innovative, safe and effective means of reducing that risk, and we ask for your support to make this happen.
Thank you, Dr. Byrne.